My name is Dr. Joy Chang, and I am a psychiatrist and addiction specialist by training. I do have the pleasure of serving as our organization's chief medical officer. And what this really means is that I have the privilege of supporting and activating the work of some incredibly committed and mission-driven teams across multiple departments. And so I'm here tonight to really share the value of what they do every day. The need for the work continues to grow. The reality is that roughly 1 in 4 adults have experienced some form of mental illness. Many of us in this room are connected to that reality in some way, and that connection is exactly why you are here tonight, whether through your work, your families, or our community. The issue is not whether there is a need. The challenge at hand now is whether we can evolve our systems of care in a way that is accessible, equitable, and ultimately sustainable to meet the escalating need. Under the leadership of Dr. Tara Keeley, our 3 outpatient mental health clinics specialize in serving individuals with what is termed serious mental illness, or otherwise SMI. These are conditions such as schizophrenia and bipolar disorder that significantly affect a person's ability to function day to day. Nationally, about 6% of adults live with SMI, and this is a population that benefits from highly coordinated multidisciplinary care. The wonderful examples of hope that you've heard so far tonight do not happen by chance. It all begins with access and accurate diagnosis, early symptom stabilization through medication and therapeutic interventions, and the synergy of a team to meaningfully engage and to change the trajectory of otherwise devastating illness. Our integrated health and nursing department, led by David Bridges, focuses on another reality that is often overlooked. Individuals with SMI have significantly shorter life expectancy, sometimes by 10 to 25 years. The primary drivers are not psychiatric symptoms alone, but chronic medical conditions that go untreated or are identified too late. Mental health and physical health are still treated separately, and unfortunately the fragmentation extends well beyond this. Consider your own care and the complexity that comes with navigating insurance, navigating multiple specialists, correcting prescriptions, and why does nobody in medicine ever seem to be talking to each other? I'm trying to fix that. Now imagine this from the eyes of one diagnosed with a psychotic illness. The role of the integrated health department is to help bridge that gap, to advocate for the client, and to again gain synergy of a broken piece, synergize the broken pieces of the healthcare system, not only to extend life, but to give quality of life. As a mentor once impressed upon me, this work is all for naught, if not to build a life worth living. Under the leadership of Director Kevin Hansen, Cornerstone is one of 5 organizations in the entire state of Maryland in the running for federal recognition as a certified community behavioral health clinic. The CCBHC model is a framework that spans the vast majority of our individual departments. It is a federally funded model of care that has gained sustained, strong federal bipartisan support over many years. It is one of the very few preserved federal funding streams available to behavioral health. It bundles cost provisions to support expansion of access, holds recipients accountable to quality, and aligns funding more closely with the actual cost of providing care. For organizations such as ours, it represents a more stable and comprehensive way to deliver services in this resource-constrained environment. My sincere hope is that the exhaustive work of our collective executive management team and Kevin will bear fruit, and that by this time next year we can proudly present ourselves as a formal site. To our clinical partners and our colleagues in government who are here tonight, thank you for being here. I am humbled by your accomplishments and your thought leadership, and we are grateful to have your support and partnership. In this constrained economic environment, we are committed to a strategic alliance to strengthen our public behavioral health safety net with you and alongside you to provide the care our population deserves. Let's give them a round of applause. I will close with this. society already pays a price for healthcare. Health insurance costs have risen faster than wages, with dramatic increases in premiums even in this past year. In parallel, billions of dollars of venture capital have flowed into the development of digital mental health platforms. And yet the gaps in our public system still persist, with the same silos of care and the same challenges with access and inequity. The issue is not simply the level of investment, it is whether we can come together around a shared vision of how that investment is directed, when the real cost is actually an individual's opportunity to live a full and meaningful life. What we are working to build is a system that is accountable to outcomes, integrated across disciplines and across partners, and accessible to the individuals who rely on it most. Your support is paramount to our mission, not only through financial contribution, but through your time, your engagement, and your voice to share our mission beyond this room. Thank you.